Aspirin is a widely used medication that helps with various ailments. Let's break down its uses, how to take it properly, potential side effects, and important precautions to consider. Aspirin is a common over-the-counter medication with several important uses. Use number 1. Reducing fever. It can help bring down a fever. Use number 2. Relieving pain. It alleviates mild to moderate pain from conditions such as muscle aches, toothaches, colds, and headaches. Use number 3. Alleviating inflammation. It helps reduce pain and swelling in conditions like arthritis. Aspirin belongs to two categories of drugs: salicylates and non-steroidal anti-inflammatory drugs. It works by blocking certain natural substances in your body to reduce pain and swelling. In addition to its pain-relieving and anti-inflammatory properties, aspirin has a significant role in cardiovascular health. Doctors often recommend low-dose aspirin to prevent blood clots, which helps reduce the risk of stroke and heart attack. This is particularly important if you've had surgeries on clogged arteries like bypass surgery, carotid endarterectomy, or coronary stent placement. In these cases, aspirin acts as a blood thinner to prevent clot formation. So, how to use aspirin? Taking aspirin correctly is crucial to ensure its effectiveness and minimize potential side effects. Here are the steps to follow. Step number 1. Follow directions. Always follow the instructions on the product package or your doctor's advice. If you have any questions, ask your doctor or pharmacist. Step number 2. Taking the medication. Swallow aspirin with a full glass of water, 8 ounces or 240 milliliters. Avoid lying down for at least 10 minutes after taking it to prevent stomach upset. If you experience stomach upset, take aspirin with food or milk. Step number 3. Tablet forms. Enteric-coated tablets should be swallowed whole. Do not crush or chew them as it can cause stomach upset. Extended-release tablets or capsules should also be swallowed whole unless they have a score line and your doctor or pharmacist says it's okay to split them. Step number 4. Dosage. Your dosage depends on your medical condition and how you respond to treatment. The product label will provide guidelines on how many tablets you can take in a 24-hour period and how long you can self-treat before seeking medical advice. Use the smallest effective dose and consult your doctor if you have any questions. If you're using aspirin for headaches, seek immediate medical help if you have trouble speaking, weakness on one side of your body, or sudden vision changes. These could be signs of a serious condition. So, what are the side effects of aspirin? Like any medication, aspirin can cause side effects. Common ones include upset stomach. This is one of the most frequent complaints. Heartburn. Another common side effect that can be bothersome. While many people taking aspirin do not experience serious side effects, it's important to be aware of them. Seek medical attention if you experience severe nausea or vomiting. If it doesn't stop, it can be a sign of a serious problem. Easy bruising or bleeding. This indicates that your blood is too thin, a known risk with aspirin. Ringing in the ears, known as tinnitus. This can indicate an overdose. Kidney problems. Signs include changes in the amount of urine you pass. Severe dizziness or dark urine. These symptoms can indicate liver damage or other serious conditions. In rare cases, aspirin can cause serious bleeding from the stomach or intestines. Immediate medical help is needed if you experience severe stomach pain. This could indicate an ulcer or severe irritation. Black or tarry stools, a sign of bleeding in the digestive tract. Vomit, that looks like coffee grounds, another sign of internal bleeding. Trouble speaking or sudden vision changes. These symptoms can indicate a stroke. So, what are certain precautions? When taking aspirin, Before starting aspirin, it's important to take certain precautions. Precaution number 1. Allergies. Inform your doctor if you are allergic to aspirin, other non-steroidal anti-inflammatory drugs, or any inactive ingredients in the product. Precaution number 2. Medical conditions. Let your doctor know if you have blood clotting disorders like hemophilia or vitamin K deficiency, kidney or liver disease, stomach problems like ulcers or heartburn, asthma that worsens with non-steroidal anti-inflammatory drugs, nasal polyps, growths in the nose, gout or certain enzyme deficiencies such as pyruvate kinase or G6PD deficiency. Precaution number 3. Alcohol and tobacco. Using these substances with aspirin increases the risk of stomach bleeding. Limit alcohol consumption and avoid smoking. Precaution number 4. Surgery. Inform your doctor or dentist if you're scheduled for surgery. Aspirin can affect bleeding, so they need to know you're taking it. Precaution number 5. Children and teenagers. They should not take aspirin for conditions like chickenpox or flu, as it can lead to Reyes syndrome, a rare but serious illness. Precaution number 6. Pregnancy. Aspirin is generally not recommended during pregnancy, especially after 20 weeks, as it can harm the unborn baby and cause problems with normal labor and delivery. If your doctor decides you need aspirin between 20 and 30 weeks of pregnancy, use the lowest effective dose for the shortest possible time. So, which medications can aspirin interactions with? Aspirin can interact with other medications, potentially altering their effects or increasing the risk of side effects. Inform your doctor about all the medications and supplements you are taking. Common interactions include blood thinners like warfarin and heparin, corticosteroids such as prednisone, methotrexate, used for cancer and autoimmune diseases. Also, be cautious with other non-steroidal anti-inflammatory drugs like ibuprofen and certain herbal products such as ginkgo biloba. These can increase the risk of side effects or reduce aspirin's effectiveness in preventing heart attacks and strokes. So, what should you do in an overdose of aspirin? In case of an overdose, seek immediate medical attention. Symptoms of overdose include burning pain in the throat or stomach, confusion or mental mood changes, fainting or severe weakness, rapid breathing, seizures or loss of consciousness. So, what should you do if you miss a dose of aspirin? If you miss a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose. Do not double up to catch up. So, how should you store aspirin? Store aspirin at room temperature away from moisture and light. Do not store it in the bathroom and keep it out of reach of children and pets. Properly discard expired or unused medication by consulting your pharmacist. By understanding these guidelines, you can use aspirin effectively and safely. Always consult your doctor or pharmacist if you have any questions or concerns. Thank you for watching. Don't forget to like, comment, and subscribe. Watch more videos by clicking on this video right over here.